Today is September 2nd. We're here with Ken, who came to me, referred for a shoulder problem, and he also indicated he has some degeneration in his knees. But we're going to focus on the shoulder problem today. Ken, describe what was going on with your shoulder, please.
Well, my right shoulder has been stiff and sore for probably the last 15 years. And when I had it looked at by an orthopedic surgeon, he told me he thought it was adhesive encapsulitis, which the generic term for that is frozen shoulder. So that's what I've been dealing with. And it's painful, stiff, there's limited range of motion on it. And it's just been giving me problems for years.
Okay, so, for the viewer, you certainly did not have a frozen shoulder because you could get it up pretty high. Show them how high you could get it before we did anything.
Probably about
that was about like that. That is correct. Okay. Yeah. What was the first thing I went for?
The joint?
No. In terms
tooth.
of injection.
Oh, the tooth.
The tooth, yeah. Right. I said to you, before I do anything to your shoulder, let's evaluate your teeth, right?
Yeah.
You had an implant and a root canal that was just removed. They checked negative. But then I started playing around with some other teeth, and one was positive, and you said to me, you know, I may have a root canal there. And you hadn't told me about that.
Right.
And it tested positive. And actually, that's not energetically directly connected with the shoulder, but I told you any tooth can do anything.
Yes.
So you allowed me to numb up the tooth.
Right.
In your case, it was tooth number 14 and upper left molar. And what happened when I numbed up that tooth?
And then we muscle tested the right shoulder again. It was immediately stronger.
It was immediately perfectly strong.
Yeah.
Yeah. Your supraspinatus muscle had gained strength. Show us the range of motion now of your shoulder after that.
Well, I can bring it up this high, and I can cross my hands like this, which I couldn't do before.
That is correct. You couldn't do that before. Okay.
And hold it straight.
And actually, I think that shoulder now has as much or possibly even more range of motion than the other side.
Feels like it does.
Great. Then I went ahead after we evaluated your teeth and we put a little bit of ozone into your shoulder in the supraspinatus area right there.
Yes.
Okay. May I post this on YouTube?
Yes.
Okay. This is another example of the potential of a dental interference intermixing somewhere else in the body. And obviously you're going to have that tooth looked at by somebody who's better at it than I am. And not that I want to see you lose a tooth, but it would, if there's a problem in that tooth, it needs to be taken care of. You understand that?
Yes.
Okay. Thank you very much. And I recently had someone who came in here with a totally frozen shoulder. I mean, absolutely frozen. And I injected a scar on his chest right here from a bypass surgery. And then all of a sudden, he was able to get his shoulder as high as you just did. Then, evidently, the next day, the shoulder froze up again. You're a patient. What are your thoughts? How would you, and you're an intelligent guy, you're an architect. How would you respond to that? Now, I told you the problem could come back, right?
Yes.
I told him the same thing. But how would you respond to the fact that you weren't cured in the first session?
Well, to begin with, if my shoulder, my range of motion is so limited on my shoulder that I can only bring it up this far, and it's been that way for years, and then all of a sudden I come in for a treatment and I'm able to raise my shoulder all the way like this over my head, which I couldn't do before, even if that reverted back the next day, what I would do is say, I've got range of motion here that I never had before, so I must be doing something right. So you want to come back and you want to reaffirm whatever the treatment was and take it to the next level. But if that's the first time that you've ever had that kind of range of motion, just because it goes away in one day, how can you discount that? You're already better than you've been for years and years. So that's the breakthrough right there.
Even if it was only temporary.
If it's only temporary, you know, you can't take years of neglect and years of misuse of the body in terms of joints and things like that, and expect that they're going to be healed overnight. I expect that I'm going to be working on this for a while to get it done, but I've already had so much improvement just in one day. I know that even if it reverted back a little bit, I would still come in and stay with that protocol because that's what I want my shoulder to feel like all the time.
Yeah, from my perspective, if you do something and you get results, even if it's temporary, I would say press it. Now, that does not include giving a steroid injection. Giving a steroid injection, yeah, you can guarantee that's going to be temporary results with toxicity.
Right.
But if you treat something distant to the site and you get better, even if it's for a day, it tells me something's going on in the interconnectedness of the body that needs to be pressed. Would you agree with that?
Yeah, you have to stay with that. You have to know that whatever that breakthrough was, even though it was only temporary, it's going to be more permanent the next time. And you have to follow up with that protocol and keep doing it to get the results that you want. You can't look at it as just an isolated accident that all of a sudden for the first time in years you were able to move your shoulder up and then the next day you can't do that.
And generally, in the case of the scar, that can happen. Yours wasn't a scar this time, it was a root canal. But in the case of the scar, if you get temporary relief, I have found that when you inject the scar a second time, you probably will double the relief time. Yeah. And when you inject it a third time, you may get total relief. I have found that repeatedly, but you can never guarantee anything. It's just that, hey, there's something here, let's investigate and press.
Right. So why wouldn't you be excited that for the first time in years you have a range of motion that you didn't have before? That tells you something. And that should tell you, the message should be that you stay with that protocol to get more permanent results. You don't abandon it.
Right. This person or a member of the person's family actually made an allegation that I must be a charlatan because of this. Now, I don't know how to respond to that, especially when you get somebody relief or range of motion that was totally unexpected.
Yeah.
I didn't even suggest to them, I didn't even plant the thought in the mind that the shoulder would get better. I never do, because I don't want it to be suggestion. Mm-hmm. I want it to be the actual result of whatever we try on your body. Did that give the result?
Yes. Yes.
Thanks.